PPE is on. Is my scene safe?
Scene is safe.
Number of patients?
1 patient.
Okay, so I have a 20-year-old male who fell down while he was dancing and hit his head on the concrete. So at this time, we're going to go ahead and call for ALS backup, and my partner will be conducting C-spine. Now that C-spine has been conducted, we're going to go ahead and introduce ourselves to the patient to check for his level of responsiveness and his general impression. Hello sir, my name is Edwin, I'm the EMT. How are you feeling today?
Not very good.
What's wrong with you today, sir?
I had everything good.
Okay, so at this time we can conclude that the patient is alert and that his chief complaints are that his head and his ankles are hurting. So next we're going to go on to the ABCs. First is his airway. As he did speak to me, the airway is clear. Next is his breathing. As his breathing is short and very shallow, we're going to go and put him on 15 liters of oxygen a minute on a non-rebreather mask. So next is C for circulation. We'll go ahead and check his wrist for his pulse. His pulse is weak but equal. His capillary refills are longer than 2 seconds, and his skin is cool, pale, and diaphoretic. So as the patient is gone into a state of shock, we're going to go and put a blanket on him to keep him nice and warm. We're going to go ahead and prioritize this patient as he is in shock. So next we're going to go on to vitals. So I'll be checking his blood pressure first. Okay, his blood pressure is at 82/63. His pulse is at 40 beats per minute, and his respiratory rate is at 30 breaths per minute, which is extremely high. So what we're going to do is we're going to go ahead and conduct the secondary assessment, starting with the head, checking from the back of the head to the front for any bleeding. No bleeding at all. Check his ears for any clear fluid. No clear fluid at all. We're going to check his face to see if there's any fractures or bones that are broken in his face. None. Open your mouth for me, please, sir. Mouth is clear. Next, we're going to go ahead and move on to the neck. His trachea is not shifted at all. His jugulars are not expanded. And his spine is intact. So next, we're going to go on to the chest. We're going to listen for any problems with his breathing. Short breaths. Check his sternum. No breakages there. Next, we're going to go into the abdomen and palpate 4 quadrants. 1, 2, 3, 4. Okay, next we're going to the lower body. Check his pelvis. Pelvis is not broken. Check his genitals. Genitals are clear, no bleeding at all. Next, we're going to go ahead and check his legs for any breakages or fractures. No breakages or fractures in the legs. Next, we're going to check the CSM on the feet. Circulation first. Pulse is very weak down at the feet. Sir, can you push down like you're on the pedal of a car door? Okay, pull up. Can you move your toes for me, sir? Okay, what toe am I holding?
Big toes.
Okay, so at this time we can conclude that he has some trouble with his feet. Next, we're going to go ahead and move on to the upper extremities. Okay, so check his arms for any fractures. Check CSM on his hands. His pulse is still weak at his wrist. Can you move your hands or your fingers for me, sir? Okay. And what finger am I holding?
Index finger.
Okay. Okay. So next, we're going to go ahead and turn the patient over to check his back and his spine. So on the count of 3, heads count, we're going to turn him to his side.
1, 2, 3.
Checking the spine. Spine is okay. No problems with the spine. No bleeding on the buttocks. So now the backboard is on. We're going to go ahead and put him on the backboard. Heads count.
1, 2, 3.
Okay. So we're going to strap in the patient. Patient is strapped. We're going to go ahead and assess any other secondary injuries, such as any other bleeding, which was not found, or any breakages for bandaging at all. with or splinting. And we're gonna go ahead and check on the patient every 5 minutes. So once again, we have a 20-year-old male who fell down while he was dancing and hit his head. His airway is clear. We put him on 15 liters of high flow oxygen per minute with a non-rebreather mask. And his circulation is weak but even, and his skin is cool, pale, and diaphoretic, which means that he's in a state of shock. We administer a blanket to keep him nice and warm. No bleeding from anywhere else on the body. The only problem that was seen is that he has a little bit of trouble moving his feet. And that is it. See.